Hello, I'm Hope Rugo, a breast medical oncologist from the University of California, San Francisco. And I'm joined here by three of my friends and colleagues to discuss the toxicity of new agents in the treatment of breast cancer. Fatima, do you want to start by introducing yourself?
Sure. Hello, everyone. I'm Fatima Cardoso, a medical oncologist, a breast medical oncologist in Lisbon, Portugal.
Sheila.
Hi, I'm Sheila Pettiford, and I am a metastatic patient, have been for almost 8 years in April. I used to live in Philadelphia, Pennsylvania, but have moved to Delaware in the last couple of years during the pandemic. And I'm happy to be here.
Julia.
Hi, everyone. I also am a person living with metastatic breast cancer. I was diagnosed in 2013. So it's going to be 9 years also in April.
We have really an amazing group and an international representation, which is also really nice, I think, because we get different perspectives. And what we're going to talk about is, I think, really important to providers and patients across the board. And that is with a host of new agents for the treatment of breast cancer, most of which have really moved us forward in terms of having effective treatment options. We've also been faced with a lot of new toxicities or side effects that we haven't seen before or that we might not have expected from the specific agent. And those toxicities across the board include side effects that are quite familiar to us, like low blood counts, but we may not advise people well enough about, but other side effects such as mouth sores, inflammation of the lung, immune toxicities, and others. So Fatima, do you want to start and talk a little bit about how we can think about these toxicities and address them?
Sure, thank you. I think from the healthcare provider point of view, what I would highlight is educate before we start the treatment. It's very important to inform the patient, but in a balanced way, like not over exaggerating certain types of side effects, but also not underestimate certain types of side effects. It's very important because an informed patient will be attentive to the type of side effects that can happen, and also teach the patient when it is an alarm or something that she or he might need to contact the healthcare team, and when it's not the case. I think that is one crucial topic. The other one is monitor. So find ways, and I think we can discuss this later on, how to best communicate between the patient and the healthcare team, but in a way that you can monitor so that you can act very early on. Most of these new side effects, if you act early on, they will not become severe. And so it is very important to know about them and to act early on. And something else is, I believe that sometimes we don't think about it all the time, is about prophylaxis. So not to be shy from using prophylactic measures, be it for the mouth sores, be it for nausea, vomiting, diarrhea, things that truly impact the quality of life of patients. And so those to start are my three major points of attention to healthcare professionals.
I think that's so incredibly important, the comments that you've made, and also that prevention and prophylaxis are so important. You don't want to have a patient not have diarrhea in the middle of the night, not have any anti-propulsive agents at home. I mean, just as a very straightforward example, it's really important. And I think also the ability to know what you should be looking for and how you can manage it. There's all sorts of examples of times when, even with some education, people on the provider's part may not have been communicated well to the patient, and then the patient is surprised and unhappy with that situation and unable to manage it. So Sheila, your comments on this is from the patient perspective are so important. How important is that education piece, and how do you manage the fear of side effects versus actually managing the side effects that might be caused by the treatment you're taking?
Thank you for that question. I really think it's a dance. It's a dance between the patient and the healthcare team. And one of the things, yes, education is absolutely important. However, you have to establish the healthcare professionals. Everyone has to establish a relationship of trust with the patient. My own circumstances were, I was very fortunate in that my the oncologist that I chose, and I really just chose one out of looking for one. I did not have a recommendation, but I did find an oncologist that listened to me. So when it came time for me to deal with a new medication, the education that she provided me was sufficient because of the fact that there was a lot of listening that had gone on prior to this new medicine being given to me. So I trusted what I was hearing, and it felt like there was a balanced situation that came about from what was being told to me, and I could look it up too. So, there still is that part of the patient that will be participating in the process as well. They can still look up things, and that's one of the downfalls of the information age we're in.
The
But
Googling.
it is a dance. I just want to go back to that. There's a dance between the person, the patient, and the healthcare providers.
So Julia, how do the patient, from the patient side, how do you balance the benefits you might get from a treatment versus the side effects, and how best to manage them?
Yeah, and I think it's interesting that when we talk with our doctors, but especially when we read about a certain treatment, the attention is really focused on the very severe and unlikely side effects that a drug has. But we don't talk as much about the side effects that are most likely to happen and will affect us, but may not be life-threatening. But especially for those of us with metastatic cancer who are going to ideally be on a drug for a very long time, we're then faced with low-grade nausea for the rest of our lives, and that's not okay either, right? So I think it's important to talk about all of the levels of toxicities and everything that can be done to avoid it.
And I just want to add something that Dr. Cardosa said about monitoring. That is absolutely important. We're in a day and time when it's very difficult to get someone on the telephone, but we do have digital charts, and other ways that monitoring can take place. As a metastatic patient, I was at a large teaching university, and every time I had to go monthly for my treatments, and every month there were questions that was asked about my condition, and I could always get in contact with somebody through the digital chart.
Yeah, so that's an incredibly important comment, Sheila. And I think that communication and how patients can feel like they have someone to go to in real time who can help manage things. And Fatima, I'm interested in your comment on that, and also just to go to the next step, which is that when we see data reported on clinical trials and how this agent we've added or substituted is better than the standard, the toxicity tables are side effects that occur in at least 10% or more of patients, and sometimes even 20%. And then they're graded, right? Where often the division is grade 3 or greater. That may not actually reflect much about what the individual patient experience is. How do we interpret that data? So communication and interpretation.
Absolutely. And I always call that attention that perhaps that is the reason, since we focus so much on grade 3 and 4, that is the reason why we don't see in the usual reporting differences in quality of life between treatments, because quality of life is affected also by grade 2, at least significantly by grade 2 side effects, or like Julia was mentioning, even grade 1, if it's long persistent, will eventually affect your quality of life. And so sometimes, like when I was saying, don't underestimate, is a little bit like that. So we focus on explaining, look, this new immunotherapy can give you all these different side effects. But then we forget to say, oh, by the way, it may also give you some nausea. And actually the nausea will affect the patient's quality of life. So I think that it's why it is so important to balance the way we provide information. However, I would like also to take on what Shayla said, that sometimes too much information is not very helpful. And that's why sometimes we have to go stepwise. And the first time you're about to start the treatment, advise on the most frequent side effects. And then later on, you have time to say, okay, by the way, this can also give a rare side effect. This is what you should look for. And if you have it, please contact your healthcare team. I think the most difficult part, at least from my experience, is for patients to understand what is really a sign of a severe side effect and what is, let's say, normal for that type of treatment. So some of the new ways of communicating, like using some PROs that are patient-reported outcomes apps, what they do is they actually help the patient and say, this that you are feeling is normal. It can wait for your next appointment. This that you are feeling, it's better if you try to reach your healthcare team right away, or this is an urgent thing, go to the emergency room near you. So this kind of triage, there are now new apps that can help do this. I think it is the most difficult part, because from when you are a patient, you don't know if what you are feeling is actually a sign of something very severe, or if it's normal for the type of treatment you are receiving.
Yeah, I think that's so important. And these new PROs or apps may help with that. Of course, nothing substitutes for talking in the end if you're confused, but it is, I think, or it doesn't fit into whatever's in that paradigm, but I think it's important. And Julia, what do you think the best way of educating the patient is when you're going to start a new treatment? So, you might be newly diagnosed with cancer, you might be have had cancer for a number of years. How you're going to start a new treatment, what's the best way to know what to look for and how to manage it?
I think that the key here is that everyone's different. So have that conversation, the doctor and the patient, about what the best way to communicate is for that specific person. Do they want a flyer listing all of the side effects, or do they want a link to a video that they can watch and understand, or do they want someone to come in and give an extra explanation about things? Because everyone learns so differently, and I think it's really hard to assume that there's one way that all patients will understand. I think with these PRO apps are great, and also another benefit is that you keep track of our side effects. Sometimes we don't even remember, well, like, when did you have nausea? Is it in the morning? Is it in the evening? Is it every day? Or right? So if you track it with these apps, then you will have this data and stored there in a form to answer your doctor those questions.
There was recently a publication, though I found it quite interesting, from Leslie Fallowfield group, saying that the majority of patients would absorb better the information if it is not just text, if in somehow it has either a video component or an image or some infographic that would help you memorize a little bit more the information.
Yeah, there's been a move towards trying to make videos to try and, because just the amount of education that's needed on the provider's side from our nurses and advanced practice providers may be overwhelming also. So things might get missed. And the idea of having videos to get everybody on the same page is very, very popular right now for this reason. And Leslie's really groundbreaking work. Sheila, what do you think is the best way to communicate information?
Well, I definitely think it's important for the doctors to recognize, as Julia said, everyone is different. All their patients are different. They can come with the same exact subtype of whatever cancer they have, but in this situation, breast cancer, and still have so many different reactions. So it's so important for a doctor, anybody in the healthcare team to listen to what the patient says, because the patient is the one that's living with the illness and knows their body, hopefully. And then it's just one of those things. It's not a one size fit all type situation at all. You give the standards, but I think it's important to offer various ways of communicating to that patient, because some people are visual, some people are really, they want an overwhelming amount of information so that they can sort through it. And then you have some people who just want the bullet points, just give them the bullet points. So again, it is important to not try to do it as a one size fit all type thing.
Yeah, that's such a good point. I'm always struck by the fact that some patients are totally on top of, listen to it all and have it. And then other people, we just can't get them to even call in for their side effects. It's just, in some ways, it's frightening for people sometimes to call in with issues. Maybe they're afraid that they won't get the treatment, or that it is related to their cancer progressing too. So trying to meet people on their own level is a real challenge and an important one. We talked about education for providers also, Fatima. How should we be best educating for these new drugs and new side effects? Because so many different manifestations can occur, and as we talked about, it might be quite uncommon. So we just want people to keep their sort of ears up for any kind of unusual toxicity we see. But we all know that the presentation of efficacy data is not adequate for education.
And again, I think when we present a new treatment, we focus hugely on efficacy, right? And then we say a few things about safety, particularly if there is a new and a severe side effect. But we don't go through details on how to best manage in clinical practice. So anecdotally, I remember that I contacted you because I was going to start using a new treatment, and you had some experience, and say, but what about this nausea and vomiting? What do you do for prophylaxis? Because I couldn't find it anywhere in the manuscripts or the presentations. So I think we need to focus a little bit more on, let's call it practical tips. If you are about to start this new treatment, what you should think about, and not just on the very severe and rare side effects. Of course, as healthcare professionals, we need to keep that in our minds. For example, with immunotherapy, that it can happen even after stopping the treatment, and a lot of time after stopping the treatment. For other types of new treatments, a new knowledge we need to gain about endocrinology, for example, something that in the past oncologists wouldn't have to deal with that a lot, and now new skills are needed. So it's also what makes, I think, our profession so exciting. There's always something new to learn, and I like to look at it from that perspective. It is not boring at all. We are always learning new things.
Indeed, and I think we've all been working with, certainly you and I have worked together on with trying to encourage our pharmaceutical colleagues to publish these papers alongside their urgency of getting out the efficacy data and publishing the papers on efficacy, but also to really do a nitty-gritty review of safety and talk about management strategies, which I'm really pleased that there seems to be a little more focus on that earlier now in the drug process, although still not early enough, but it's getting there. So that's a good thing.
Yeah, also, and Julia, you mentioned this earlier, is how important it is for the individual patient's quality of life to understand how these side effects can affect them. And it really is one of those things where we have to make personal decisions. What might be good for one person in terms of what can happen with side effects, and they can still function, might not work with someone else. If you're a person who's dealing with maybe metastatic disease and has children and a household and a dog and a cat to take care of, what might be something that I can handle, being that I'm a single person, is not what they can handle. So that's all a part of the education piece. That's all part of the teamwork. That's all part of the communication process. It all comes into play.
That's such an incredibly important point. And I think as we're sort of wrapping up a little bit, I'd like, it would be great if everybody had some points to make that pull together some of our conversation. Julia, do you want to start?
Yeah, I was going to add specifically about the topic you were just discussing with all the knowledge that an oncologist team has to know, and the fact that all these different areas of our health are being affected by these new treatments. I think one tip for patients and their teams is that all the other providers around the patient, they may not be as informed about the disease and the treatments that they are on. And sometimes we patients end up getting information that isn't up to date with the latest drugs and things like that. So when we do talk with someone about our issues, make sure that they are informed about these new drugs. For example, skin issues is something that we often see, and there are dermatologists that work with cancer patients often, and they're very informed about the side effects that come with these drugs. But there are others who never see these sorts of issues and may assume that it's something completely different. So I often just go to doctors that my oncologist team collaborates with, and really get referrals from them, because they send their patients to these people often, and these are doctors that see cancer patients, and we're a very unique group.
Let me just ask, is it's a really good point, and I have the same thing. We all have a little stable of people we refer to for various issues that we can reach on speed dial, but Fatima, there's recently been, appropriately so, more push to try and evaluate side effects by racial and ethnic subgroups. I think we're still pretty crummy at it, but we are making some progress. How important is that to you, and when you think about patients and managing them?
Well, I think that is quite important. I think one area that, speaking now of research, that I think is underused really, it's the use of all these new technology as genomics and sequencing to understand why people react differently to the same treatment. Why for some either ethnic or other reasons you would have a different metabolism or something else that justifies that you have a very high side effect to a very high rate of side effects to a certain treatment, while in other regions of the world that doesn't happen. And not to go into these new drugs, but a very old drug like a taxane, I found it different between the Portuguese patients and the Belgian patients, the two countries where I've worked with. And I even found that it should be genetic, because the Portuguese living in Belgium reacted differently than the Belgians themselves. And so maybe there is something in the genetics that justifies also the type of side effects that you have. And I make a plea also for us to dedicate research on understanding why certain side effects are related to race, others are related to maybe some other types of genetics alterations that will lead to an increased side effect.
Sheila, comments?
That is just excellent. Excellent to even consider it, because it is so obvious. Really, to me, it's obvious. It's an obvious situation that because there are things that are underneath the skin that we don't understand, we have to take that into consideration when we are dealing with all these wonderful, I call them miracle drugs that have come about in the last 20 years. But there still is a lot more to be done. And I try to participate in any type of organization that's encouraging clinical trials, diversity in clinical trials, because you need to have people of all different ethnicities in order for us to get to those answers that we're looking for. That's fascinating that you found that out, Doctor.
And I have a pleasure of being a member of a patient-led initiative called the Patient-Centered Dosing Initiative. And what we are doing is we're really highlighting the discussion around dosages of drugs, especially in the metastatic setting. And metastatic breast cancer is what we're focusing on, although it could apply to any type of cancer. We are advised by a number wonderful world-renowned physicians, Dr. Rugo being one of them. And Ann Loser, the leader of our group, has spoken at ASCO about this topic of dosage. What we're seeing is that the dosage determination for oncology drugs is still done in the same way that it used to be done decades ago, and mostly with the curative intent of early stage. And metastatic patients back then really didn't live long at all. But what we're seeing right now is people with metastatic breast cancer that are able to, in some cases, live a long life managing their disease, are put on doses that are too high for them to be able to manage the side effects, and then end up having to go off a drug, which means they have lost one of the tools in their toolbox. So what we like to say about dosing is that for metastatic patients, it's a marathon and not a sprint. So if we throw all the poison at the patient from the very beginning, they won't be able to take that for a very long time. And in the metastatic setting, the goal is to stay on each therapy for as long as possible. So if we burn one of the cards early on, then you have to move on to the next one, and that is finite, because at some point there are not enough drugs that can help a particular patient. So PCDI is really getting a lot of visibility with the FDA and experts. People are talking more about dosages, and the FDA is now providing guidance for pharmaceutical companies to study different dosages in the clinical trials from the very beginning. So this initiative is almost 3 years old, and we have made tremendous impact since then.
Yeah, it is. I think this is an incredibly important area moving forward. And thankfully, there's so much interest now in not only promoting diversity and enrollment in trials and education to promote diversity, but also in looking at differences in both efficacy and side effects, which is really important. So maybe I'll just thank everybody for your contributions and amazing perspectives on this incredibly important area. As we move forward with better agents, we need to also make sure that we're understanding what the side effects are, managing them, and hearing the voices of our patients. Thanks very much.
Thank you so much.
Thank you. My
Thank
pleasure.
you.